Hi everyone, my name is Mike Lang and I'm an education consultant with Cancer Control Alberta, as well as being a cancer survivor myself. I can't remember everything about those first few weeks and months after my own cancer diagnosis, but I do remember feeling incredibly overwhelmed for many reasons. So if you're watching this video and feeling that way, just know that it's normal. And also know that by watching this series, you are starting off on the right foot. It will help you be as prepared as possible for your stem cell transplant by explaining how to prepare and what to expect during treatment and recovery. Through these videos, you'll be hearing from many healthcare professionals as well as Scott, a patient who has undergone a stem cell transplant. There are two different types of stem cell transplants. An autologous stem cell transplant, or autotransplant, is where healthy stem cells are collected from your own body and then later returned to your body to repopulate. An allogeneic transplant, or allotransplant, is where stem cells from a healthy person, the donor, are transferred to your body. So before watching, try to remember which one your doctor suggested for you and read the title of the videos carefully. Scott's cancer experience is unique, and just like everyone who undergoes a transplant, he had unique treatments and side effects. But we can still learn from his story. It's our hope that through Scott's story and the information provided by the bone marrow transplant team, that you will feel as ready as you can be for your own transplant experience. So let's get started.
I was in the situation where you are going to die from the cancer that you have, but perhaps if you're strong enough and we were able to do the stem cell transplant, but it was the maybe. It's like I could survive for have more experiences and live my life. In the end, I told my doctors, I said, I trust you. You guys are experts. If you think this is gonna help me live, I'm with you. I'm gonna walk this walk with you. And that was it.
The common phrase of stem cell transplant and bone marrow transplant are really interchangeable terms. Bone marrow transplant is something where we end up taking blood or bone marrow stem cells from that, the baby cells, the precursor cells from the bone marrow, and then we stick them in the freezer for a couple of weeks. We give a whole bunch of chemotherapy to someone, which really helps us to destroy as much of the cancer as we can possibly get, with the unfortunate side effect of killing off the bone marrow. Now, getting your bone marrow or your bone marrow stem cells back allows you to repopulate it. It's seeds, really, to help things grow again. So the goal of the stem cell transplant is different depending on the nature of the disease you have. Some diseases we talk of as being cure, have definitely a cure potential with that transplant, the high dose chemotherapy. Other diseases, unfortunately, are very resistant, and there'll be some residual amount left over. With every 1 or 2 years, there seems to be revolution in technology, and who knows if the next therapy might actually end up being a cure. But the curves are certainly going in the favor of patients and patient care and patient survival at this point. With the autologous stem cell transplants, someone may be admitted for as long as 3 to 4 weeks if there are some complications involved. Often you can come back and forth in and out of hospital and maybe stay as little as 2 weeks if everything goes extremely well. So there are those two extremes for the actual autologous transplant on average. When one gets that huge list of appointments, the person behind that is the nurse coordinating all of the appointments and really looking after the file for someone. So you'll get to know them, and they'll be your best friend and really your navigator through this entire experience as well.
There was a lot of appointments from my recollection. They really try and make sure that you're aware of the seriousness of the side effects and what is possible, what could happen, and how deep the valley could be, and side effects on your way out. That is all gone over very, very thoroughly. And the people that are going to be impacted, it'd be good for them to be in on it with you so that you're able to, you know, even if you forgot or whatever, but your family's aware of what's coming and what you're going to be going through.
At the first meeting, you'll have your bone marrow transplant physician there. You'll have, or designate, such as a nurse practitioner and the nurse coordinator that you've been dealing with. Some of the tests that you have been assigned to include lung function tests, heart function tests, including ultrasounds of the heart or heart tracings as well. During this time period, your health will be assessed. So I encourage people to keep a journal, try to jot down some key points if needed, but more importantly, to have a question page and really to write down their questions, because the questions can arise at any point in time. Patients have ultimately the greatest role in their treatment because really they're agreeing to the therapy, they're undergoing the therapy, and ultimately they're the ones that have to deal with the side effects of therapy and the benefits, I think, as well. Obviously, we try to minimize the side effects and make and deliver as safe a product as we possibly can, or therapy. But there's certain things that people can do to really help out their situation, especially when it comes to transplant. So the transplant will knock you down so much. But if you're starting at this level versus starting at this level, you know, it's a lot easier to get fully functional if you're higher, in a higher functioning state before the transplant. So really, I think challenging yourselves to walk more, do more activity, get a bit more active, more in shape before transplant is good. Slowing down on smoking, other high-risk activities would be also advisable. Get the lungs as healthy as you can. We all revolve around the patient and the person that's getting the transplant, but really the linkages are only as good as the relationship is strong. So this is where informing the team of any of these changes is really key, and having that open relationship with them is very important, because we do want information to help people out as much as we can.
For the transplant, there is 4 stages. So number 1 is getting the mobilization chemo, and 2 is for patients to get the GCSF. Afterwards is apheresis, and then the stem cell transplant. It is important for patients to tell their healthcare team if there's any concerns at all during, before, or after their treatment. If they're experiencing any symptoms or just any changes to their body, it is important to tell the healthcare team right away, because the sooner we can treat it, the better we can get it under control, and the better we can prepare the patients for transplant.
So we're very fortunate to have a lot of supportive care elements available to patients. We have psychologists such as myself, as well as social workers, psychiatrists, and nurse navigators that are part of your supportive care team, depending on which area you come from. So it's important for out-of-town patients that they have accommodations near our major centers. So that will be for both collection, they need to have accommodations, as well as for the transplant itself.
The nurses that I talked to were I mean, they told me, they said, hey, this is gonna kick your butt, and you're gonna think, like, what on earth is happening to me? And I mean, I certainly did. And sure enough, I mean, it helped me. And it's been amazing. I volunteer at the Cross now. I serve tea, coffee, cookies, and squares to people in the lighthouse room, so we call it tea time. I talk to them, tell them my story, and we compare stories a little bit, and it's good when you can tell somebody, you know what, I've been down the bumpy road as well, and there is light at the tunnel, and it's not a train.
Well, hopefully after watching this video, you have a better idea of the overall process of an auto transplant, as well as some practical tips and tools to help you prepare. One of the important things I took from the video is that it is important to go into the transplant process as fit and healthy as possible. This may include being more physically active or quitting habits like smoking or eating poorly. No matter what it may be for you, it is good to know that you can have a big influence on your transplant even before you are admitted to the hospital. When I was going through my own treatments, the doctors told me that one of the reasons I managed the side effects fairly well was because I was a relatively fit person before I began. Finally, you heard a lot of potentially new terminology in this video, such as mobilizing chemo, apheresis, and GCSF. The next videos in this series will explain these concepts in more detail, so feel free to move on to the next one when you're ready. We'll see you soon.